Hi guys, Dr. Maggio here, episode 7 of Ask the Doc. Got a really good question from Dan on Facebook. He wrote, been dealing with a shoulder issue for about 3 weeks that I'm working on with my massage therapist. They specialize in deep tissue / sports massage. It hurts like hell during the treatment, especially when they get in there with their elbows. I feel better after, but the relief doesn't seem to last. Do you think I'm in the right place to get this problem resolved? So the focus of this video is going to be my take on massage therapy for trying to fix an injury. So to answer Dan's question, and everyone always knows me, I'm brutally honest, you are not in the right place to fix your injury. This video isn't something where I'm going to go in and bash massage therapy or anything like that. Just going to shed some light on some facts and common pitfalls when trying to fix your injury with massage therapy. Massage is good. I mean, I get massage once or twice a month, and I love it. What is massage good for? It's really good for relaxation. Say you just have a stressful week and you want to go down and lay on the table and relax and just not think about life for an hour or so. It's great. It's also really good for recovery. Say you had a really hard workout that week, or you did a competition or ran a marathon. It's really good to get in there and start to stimulate the muscles, get some of that soreness and bad blood out of there, get some good blood flow. That's what it's really good for. The problem here is when trying to actually deal with an injury. Massage therapy just lacks in diagnosis. It's not their fault. They just don't have a training in their curriculum. They go to school for about 6 months to a year, get their training in anatomy and actual treatment itself, but there's not a real big focus on the diagnostic component of it. And I always say to people, if you don't know what the problem is before you start to fix it, there's no way you can actually fix it. So the other issue that we have here is Dan asked about deep work. Deep work, I think, is very detrimental to a problem, especially when someone gets in there with their elbow and starts to grind on stuff. The elbow has no tactile sense or feedback, so you don't really know what's going on. So if people get in there and get these muscles grinded on and beat to hell and it hurts like crazy, you're actually doing more harm than good. When you get in there, you stimulate some receptors in the muscle and the muscle's able to relax. What this does is buy you a temporary window where you feel some relief and you feel good. All that's really doing is confusing your brain by loading it up with a bunch of receptors so you don't notice the pain as much. It's the same thing when you jam your hand in the door and you shake it out like this. It's just blocking your brain. It didn't do anything to improve the function. And actually, when they get in there, they can have a lot of damage to the tissue, especially if they're sitting there grinding on your ass on your sciatic nerve, or who knows where else they kind of grind with the elbow. So if you go into a therapist and they're grinding on you with your elbows, you need to get out of there because they're actually doing more harm than good. So massage does serve a point. My thing for massage is it would be great once you actually fully get your problem diagnosed and accurately treated by a soft tissue specialist that's going to break down the dysfunction. Usually that dysfunction is adhesion, and once you restore the normal mechanics to the muscle, it's going to be really good. Massage will kind of help you continue to keep those muscles healthy by promoting good blood flow, proper recovery, and everything like that. So thanks for the question, Dan, and we'll see you guys next week. And once again, thanks for watching our videos, and please feel free to share with anyone else that you think this would help. Thanks.